Hello and welcome, it's Chris from Christopher Hold Training, and welcome to this week's tutorial where we're going to delve a little bit deeper into the truth about back bends, cobra, upward facing dog poses, back extension exercises, and how it all relates to lower back pain. So when we talk about back bends, what we are talking about is this type of posture. Upward dog poses and cobra is these positions. And then you've got back extension exercises, which is this position. So what we're going to do is we're going to delve in to try and find out what are the differences and what are the similarities and injury mechanisms when it comes to lower back pain between these three types of exercises. Before we get into that, I just quickly want to mention my social media, and you can see that up in the top right-hand corner. So you can come to Twitter, Facebook, Instagram, and YouTube. Please do like, follow, and subscribe. Please do add any comments below this tutorial, any questions that you may have, something that you may have learned or something that you found interesting. I'll reply to as many as I can and hopefully be able to give you some more insight through answering any questions that you may have. Alternatively, if you come to the link at the bottom of the page, which is also in the description, what you can do if you are suffering with lower back pain and you want to gain some greater insight into it and you want to reduce that lower back pain, you can book on a remote lower back pain consultation with me. Just follow the link. You'll then enter your name and email address, fill out a questionnaire, submit those answers, and that will allow me to read those answers and start forming some recommendations and advice. What will then happen is we'll then go through a consultation. So I may ask some supplementary questions if there's anything that I need to add or ask of. And then I will submit my recommendations and advice. In 7 days, I'll then follow back up with you to make sure everything's going on as it needs to. Hopefully your back pain will be reducing. If you do have any further questions, that's then your opportunity to ask, and then I can follow up with even more recommendations and advice to take it a step further. And if you then want to book any more consultation sessions, then you're more than welcome to. So coming back to our topic today, where we're going to try and find out some common similarities and differences between yoga poses, back extension exercises, or that extension of the spine in relation to lower back pain. In part one, we're just going to talk about the spine and try to gain some understanding of what's happening to the spine when it hyperextends or you go into those extension poses. Now, a lot of injuries when it comes to extension and even flexion is centered around joints called facet joints. Now, I've taken this short quote from Spine Foundation or spinalfoundation.org, and it says, when the spine is forced backwards into an exaggerated arch, this forces the facet joints, which are these joints here, which go between the spine here and here. It forces the joints to override with bruising of the nerve, stretching and laxity of the joints, and may result in subsequent abnormal micro-movements at this segmental level or a disc rupture. So we could get disc rupture from the disc here, or we could get bruising of the nerve, and also it talked about micro-movements within that segment, and the segment is essentially the disc and the vertebrae. So the vertebrae could sort of go through what's called a micro movement, which could then send muscles into spasm and create pain. So that's, in a sense, a bit of an overview when it comes to facet joints and motion and facet joints in that extension pose. And I suppose one extra thing to mention, you've got flexion here, which is in a sense sort of pulling the joints apart. And then you've got extension here. So these are the extension poses that we're talking about, where they kind of squash together. So this is where the problem lies, in the fact that the joints are getting squashed together. And what we'll do now is we'll take each one of those poses and we'll talk about it in a little bit more depth in regard to the specific injury of that movement or posture. These next two slides, we're going to focus a little bit more on the poses, so the back bends, the cobra, and the upward facing dog poses, and then we'll come on to the back extension. So in these next couple of slides, we're going to be focusing more on the spine itself, the vertebrae. So we're also going to talk about something called spondylolysis and pars defect. Now, a pars defect or spondylolysis is a stress fracture of the bones of the lower spine. So you can see we've got the facet joints here that we've talked about. So we're doing that through there. And then we've got the pars interarticularis, which is this part of the spine here. So these fractures typically occur due to overuse, so overuse of the spine. Pars defects are caused by overuse of the lower back, mainly from sports that involve repetitive backbend-like motions. For example, examples include gymnastics. Now, again, I've taken the quote verbatim from this article here. Now, the reason I've done that is, and the reason I've included gymnastics in that, is that a lot of yoga poses are a derivative of a gymnastics exercise or pose, simply because that's how modern yoga was designed. It was designed from, or it's a sort of a subset of gymnastics. So hence why I'm using that. So what we have to understand is that the injury mechanism comes from repetitive backbending and overuse. So it depends on the specific nature of it, which is what we're able to understand from the consultation. But when we look at the general mechanisms, what we tend to find is that the pars defect, so this fracture here, come from overuse and repetitive backbend like motions, like you see in the standing backbend that was in the first slide, and then you've got the cobra poses and the upward dog facing poses as well. Now, that's not to say that it's going to create this injury within your back. It just is there to highlight that those poses are potentially the mechanism if you are in pain from those poses. So what we've got to understand is more so that these are the mechanisms that are out there, and then we've got to apply your specific pain and movements, postures, positions and loads to that to see if they marry up, and then we can start to build a better picture of, are these poses in fact causing your back pain, or is it something else and you're okay to do these poses. That's what this video is trying to help point you in the direction of. It's not here to say stop doing all yoga, all pilates, all backbends, all cobras, all upward facing dogs, because that might not be so useful. But what we can do is we can start to understand risk. So what we'll do is we'll go straight onto the next slide and talk about this a little bit further. And to add a little bit more to that, I've taken another quote from another article on isolated fracture of the vertebral articular facet in gymnasts. So again, I'm talking about gymnasts because, again, as the quote then describes, gymnasts routinely place large forces of hyperextension, hyperflexion, compression, and lateral rotation on their spines, performing such maneuvers as front and back walkovers, flips, vaults, and dismounts. Now, obviously, within yoga and Pilates, these types of things aren't happening to that extreme. But again, what it is highlighting is that these hyperextension and hyperflexions, potentially with some compression and lateral rotation in there as well, are creating these pain patterns or injury mechanisms which can lead to lower back pain. So what we've got to understand is, as we start to build a picture of, or as you start to build a picture of your lower back pain, you can start to understand if these types of exercises or poses are useful for you to do. Because a lot of people who have done yoga come to me with lower back and hip problems. And what we've first got to establish is where these pain mechanisms or injury mechanisms are coming from. What positions, postures, movements and loads are starting to create these pain patterns. And then what we can then do is we can then start building an exercise regime, be that it involves traditional exercise, forms of Pilates, forms of yoga, whatever it might be. Or if they're going to continue doing yoga and Pilates or gymnastics, then we can start to put together a more specific routine for them. Maybe some possible things to try and eliminate, some things to minimize, and some things to do more of, and add in, if that makes sense. So we're not just saying stop doing this and start doing that. We're talking more about, you might want to think about either eliminating, minimizing, doing more of, or starting to do. So you've kind of got that continuum and that scale between all of these different types and options. So it's very much thinking about, first of all, yes, this is the mechanism, and these are the types of mechanisms that can injure the spine. How do I then specifically go about reducing the pain and building a healthier spine around all of that? And again, this is where the consultation can come in, because I will be able to highlight and give you more insight into your pain mechanisms through the answers that you give me from the questionnaire, and then we can start having a little bit more of a dialogue around maybe these are the things you want to start doing and stop doing. Once we've got that, we can start testing and measuring it by saying, yes, my pain has reduced, or no, my pain has increased. Okay, then we need to then start moving forward and find out what is going to reduce your pain rather than increase it, if that makes sense. So what we'll do now is we'll now go on to and talk about back extension exercises and some of the differences between the exercises or the back extension exercises and the poses that we've talked about so far. The back extension exercise, although it is using the extension of the spine and it will still be having an effect on the facet joints, what it also has is it has a compression effect, or let's just say more so of a compression effect because of the muscle activation. So a commonly prescribed spine extensor muscle challenge, the Superman, which is similar to this exercise, this is more of a back extension. The Superman, the lady would have hands up over the head like so, involves lying prone while extending arms and legs. Now this results in 6,000 newtons of compression to a hyperextended spine, transfers load to the facets, and crushes the interspinous ligament. So what compression basically means is, if we look at this image over here, you've got the hand squeezing the water out of the spine. Now the hand is creating the compression that the muscles create around the spine. So when the muscles activate by lifting the chest and shoulders up off the floor, so when those muscles activate, they cause that compression effect around the lower part of the spine. So if you have back extension, if you have back pain and you get it in these extension patterns, then it's not so useful to do this exercise as a means of trying to strengthen the back, because the more activation you get, the more compression you get, and therefore the more pain that you will start to create. So needless to say, this exercise is contraindicated for anyone at risk of lower back injury or re-injury. So with regards to the poses and the differences between the two, what you have is you have the lady's arms on the floor like this, holding her body up. So you get less of the muscle activation. But what you do get still is the crushing of the facet joints. Obviously, you get that with the back extension, but not as an extreme degree. So it's very much understanding the differences between the two, and the mechanisms can be different. So you might experience pain in the back bends, but not the back extension. You may experience pain in the back extension, but not the back bends. But you may then experience pain in both. So it's understanding the differences between the two, because if you get pain in one direction or from one exercise or one pose and not the other, it starts to tell you a slightly different story about your back pain. Now, with regards to, again, understanding your back pain, it has to be specific to you. So you have to understand your specific pain patterns, but you also have to understand the overriding mechanisms of injury. Once you understand the mechanisms of injury, you can then understand your lower back pain a little bit better, and then you can start understanding what you need to start doing to take that forward in order to overcome your lower back pain. Because if you're missing one of the two steps before, then in some respects, it's much more of a stab in the dark. When you start understanding the mechanisms, which is what we've started to do, and when you start understanding your lower back pain, which hopefully has started to happen just by watching this video, but you can also do during the lower back pain consultation, what you then have is it starts to build a picture for you. So then when it comes to choosing exercises, choosing poses, choosing ranges of movement within those poses and exercises, it starts to help you reduce your pain and then ease the pressure on your lower back, and then therefore overcoming the lower back pain. So hopefully this has given you a better understanding of your lower back pain and of these types of movements, postures, positions, and loads on the lower back, and then you can start moving forward. And as I mentioned, please do come along to any of my social media, which you can see up in the top right hand corner. Like, follow, and subscribe. Add any comments below. If you want to find out more about the lower back pain consultation, add some comments below, or just go straight across to the page, enter your name and email address, submit or answer the questions and submit it, and then I'll start the process of my recommendations and advice in order to help you overcome your lower back pain. So many thanks for listening, many thanks for watching. My name is Chris, and I hope to speak to you and work with you at some point in the future.